Welcome to the Brilliant Board Review Podcast, your trusted source for high-yield board prep, CME, and the latest in clinical medicine.
All right, let's talk about transcatheter mitral valve repair. Now, this would sound impossible 10 years ago, but if you follow the progress of TAVRs and watch how they've just expanded, you would know this is happening. The mitral valve is probably one of the more complex of the valves. Now remember, it gets that name, the mitral. It's kind of a hat, a weird bishop's hat. You can type in weird bishop's hat and type in mitral, and you'll see what I'm talking about. It's like a sail. Very difficult to repair. It's one of those ones that's harder to take care of. And there's been more trials, and as the technology gets better and better, I think transcatheter is going to be the way to go in the future. Just a matter of time. So we're talking about two trials, the ReShape heart failure, ReShape HF2, which is transcatheter edge-to-edge repair to medical therapy alone. You say, why would they do medical therapy? Because these patients did not qualify. They were too sick, basically, or had too many other medical problems to qualify for getting a surgical mitral valve repair. In this patient, you have 505 patients, mean age is 70. Okay, they had symptomatic heart failure and moderate to severe functional mitral regurgitation, in which isolated surgery was not recommended at that time. So between medical therapy and edge, there was no difference in mortality. This is a big thing. So no difference in mortality, but the transcatheter edge-to-edge repair outperformed medical therapy alone in first or recurrent hospitalizations for heart failure or cardiovascular death. So less admissions. Also a mean improvement in the Kansas City cardiomyopathy questionnaire score. So they felt better. So they felt better and didn't go to the hospital as much. Now, the big thing is there was no change in death, okay? And so these are things that will move along as we get better and better at these. Now, the MATTR study was transcatheter edge-to-edge repair to surgical mitral repair, okay? Just 208 patients, mean age is 71, and they had severe mitral regurgitation. The 1-year rate of death, heart failure hospitalization, mitral valve reintervention, meaning they had to go back and repair, left ventricle assist device implantation, and stroke criteria met for non-inferiority, okay? So was not inferior. But the major adverse events at 30 days was less frequent with transcatheter edge-to-edge repair. It was significant, 15% versus 35%. There was no difference in 6-minute walk time. NIH, New York Heart Association class, or change in the Minnesota Living with Heart Failure score. But this is a start, and this is where we think of this is where things are going to start changing, where mitral valve repair will be more of a transcatheter. And we can imagine a day when TAVR will be taking over instead of an open heart or an open surgery.
Thanks for listening. Visit brilliantcourses.com to learn more and claim credits for this educational activity. See you next time.